The Morbidity and Mortality Weekly Report, published in the United States by the CDC, Centers for Disease Control and Prevention in Atlanta, Georgia, has few subscribers in France. They include Willie Rosenbaum, an infectious disease specialist at Claude Bernard Hospital in Paris. At 35 years old, with his motorbike, his long hair and his past as an activist in Nicaragua and El Salvador, he cuts a curious figure in the medical community in Paris. On the morning of the 5th of June 1981, he is thumbing through the MMWR that has just landed on his desk. In it, there is an account of pneumocystis pneumonia, an extremely rare lung infection. It was assumed to have been almost eradicated, but according to the American service that records dispensing rates for medications, it has made a sudden, almost unbelievable resurgence. While pneumocystis almost exclusively affects severely immunosuppressed patients, the 5 cases recorded in California were young, previously healthy males. Of the scant details available to the American public health system, the article notes that, curiously, all the affected patients are homosexual. Willie Rosenbaum closes the report and goes back to his research work before spending the afternoon seeing patients. That day, 2 men come to his surgery. They are holding hands. One of them, a gaunt airline steward, complains of a fever and a cough that has lasted now for several weeks. Since none of the doctors he has consulted have succeeded in treating him, he has come to the Department of Infectious and Tropical Diseases at Claude Bernard. A puzzled Rosenbaum looks through the patient's medical file. He examines the young man before ordering X-rays and various pulmonary tests. When the results come back several days later, they confirm what Rosenbaum suspected. The patient is suffering from pneumocystis pneumonia. It is an extraordinary coincidence. The patient's every symptom precisely corresponds with what the doctor has read in the MMWR. This young homosexual man with no reason to be immunosuppressed is suffering from an extremely rare pulmonary infection. It is right here before his eyes. The same disease, one thought to have been almost eradicated, has been observed in 6 patients, 5 Americans, and now 1 Frenchman.